Hi Team Phoenix and welcome to my YouTube channel. This is Catherine Minor. Please call me Kate Mimi. I'm happy to have you here, and we do two things on my YouTube channel. The first thing is that we break medical jargon into simple language. So we discuss various medical conditions and we break them into a simple language where you can understand what is happening to yourself, to your loved one. The other thing is that we talk about healthcare workers and their issues. So we discuss about daring abroad, especially working in the United Kingdom. I know I've been talking a wee bit about process of nursing, leaving Kenya, coming here and anywhere else in the world, coming to work in the United Kingdom. Those are things that I am passionate about. So I promised you last time that we are going to talk about causes of kidney disease. That is because I started with kidney disease as one of the topics that I am very interested in, because I'm a kidney nurse, or a renal nurse if you please, somewhere in the United Kingdom. So I'll be happy to take you through chronic kidney disease and its causes right now, right here. So let's do this. A quick Google search tells us that in the United States, diabetes and high blood pressure are the leading causes of kidney failure, representing about 3 out of 4 new cases. So this is the picture globally, that diabetes and high blood pressure are the leading causes of kidney disease. So guys, just like you have seen in our quick Google search, diabetes and hypertension are the leading causes of chronic kidney disease. So it means that if we take care of these two diseases, then we will have taken care of a very big percentage of the reason why kidney disease happens. Now you listen, they are not the only two causes. We have diabetes, we have hypertension, we have another inherited condition called polycystic kidney disease. With time I'll talk about that one as well. We also have intrinsic diseases that attack the kidney themselves. So diseases or conditions that will damage the kidneys, not being related to diabetes or hypertension or even polycystic kidney disease. We also have infections that can attack the kidneys. The most common ones being chronic urinary tract infections, that is infections that ascend from the urethra downwards and then upwards all the way to the kidneys. Infections which are very hard to treat. These are the ones that eventually give us kidney disease. The other one, which many people may not be aware of, is abuse of some painkillers. This class of painkillers is the non-steroidal and anti-inflammatory drugs. We call them NSAIDs. NSAIDs include common drugs like or common medications. Let me use the word medication. Common medications like aspirin, brufen. How many times do you feel pain and you just go and rush and get aspirin? You go and rush and get ibuprofen. These medications contain something that mess with your kidneys. They mess with your prostaglandin release in the kidneys. Now that is not important. What you need to know is that those two medications are very commonly implicated when you talk about kidney disease, and this is something that most people do not know, and it is very important for you to know that. Now let us talk about hypertension. So what really happens with high blood pressure that gives us chronic kidney disease? And the time I say chronic kidney disease, I'm talking about a disease that has happened over weeks, months and years. You could be living for as long as possible without even knowing that you have chronic kidney disease. So with hypertension, remember last time we talked about the kidneys being a sieve. So this sieve, it is simply a lot of blood capillaries, blood vessels that are supplying blood to the kidneys, allowing filtration to occur, just like I demonstrated last time. I will make sure that I attach that video. I'm not sure whether it is here or here. Honestly, YouTube is just a mystery to me. So either of this side, but I will attach that video, and you can see my illustration about the sieve. So what happens over time is that with consistent high blood pressure, the force with which we are pumping blood from the heart to the kidneys, we get this sieve narrowing and hardening. So these small capillaries, they narrow and then they harden. And this becomes a very ineffective sieve. So your kidneys start failing. So that is as simple as what happens. And remember, this is a disease where you will not know anything is happening. Hypertension, high blood pressure will give you kidney failure. And this is something that everybody out there needs to know. Please have your blood pressure checked. Fair enough, we have different range of blood pressure for everybody, but your doctor will always tell you if it is elevated, that is it. If it is higher than it is supposed to be, then you need help. And the help usually comes, number one, in dietary restrictions. We say that when you take a lot of salt, remember the table salt, maybe you're cooking and then you're like, when you come to the table, you're like, no, I need more salt. That salt is encouraging retention of water in your body. And with retention of water, we are increasing the blood pressure. Furthermore, salt itself contains what you call sodium. Sodium will cause hardening of the blood vessels. And remember, what have I said? I've said that the problem with high blood pressure is that we're having narrowing and hardening of the vessels or the capillaries that are supplying our kidneys with blood. So if we take high sodium content, then it is going to harden our arteries, harden our veins, harden our capillaries. And it is not only table salt that is giving us extra sodium. Ladies and gentlemen and everybody else, processed foods, think about sausages, think about bacon, think about think about any processed food. They always have a higher sodium content. So you may not be taking table salt per se, but you will end up with a lot of sodium content in your body simply because you're taking fast foods. And remember, the other thing is fries, nachos, or things like that. Really, they have a lot of sodium content. When you have too much processed foods, you end up feeling thirsty simply because sodium follows water, or water follows sodium. Think about salt follows water, salt follows water. Anywhere in the world, salt will always follow water. So when your body senses that you have so much sodium concentration, that is salt, it will naturally demand for water. So you will end up drinking a lot of water, and what will happen? Your blood pressure will be elevated. So what about the people who already have a diagnosis of high blood pressure? What about them? And this is where I have a major problem with our healthcare approach. Globally speaking, I used to think it's a Kenya problem, but I've come to appreciate that it is not. It is a global issue. Look, whenever you have a condition called high blood pressure, it is important for you to be aware that it is not only your heart that is going to be affected. You will not just end up with heart failure. No. We are also thinking about the kidneys. I do not know why we do not emphasize about the kidneys so much, but I want you to know today, Team Phoenix, that it is very important for our moms, our dads, our grannies, or our friends, our loved ones, anyone who has a diagnosis of high blood pressure. It is important for them to be on medication that are helping their kidneys. We have some medications that damage kidneys, yet they are supposed to be treating blood pressure. So it is important that if you have high blood pressure, your doctor assesses the function of the kidneys, and if the kidneys are slightly damaged, your medication is changed. Does that make sense? Look, we have one medication here which is going to cause, it is going to treat blood pressure, high blood pressure, but it is also going to give us damage of the kidneys. That's one. We have another medication that is going to treat high blood pressure or control high blood pressure, but it is not going to treat to mess with our kidneys. Now, what do you do as a healthcare provider, or even as my lovely Team Phoenix? What you need to do is actually to know, first of all, how are the kidneys functioning. So for anybody out there who has had a diagnosis of high blood pressure, it is important that we check your urine. Remember last time I told you that a urine analysis is a poor man's kidney biopsy. So we do a urine analysis. We need to check how your what is in the urine, because we say that whatever is in the urine is actually telling us what is happening up there in the kidneys. We are also going to draw some blood from your vein, from your arm most likely, and you're going to check. These are the tests that I was talking about last time. I said more advanced tests. This test will show us how exactly are your kidneys functioning, and if they have any type of damage, and however slight it is, your doctor is in a position to change the medication into medication that are actually protecting the kidneys. Medical people will call them renoprotective medications, but in Team Phoenix, we don't use jargon. We just call them medications that are going to protect our kidneys when somebody has high blood pressure. Please listen, these are not medication for everybody. It is for people who have high blood pressure already. The other thing that we need to know is we need to stop self-medication, over-the-counter use of ibuprofen, aspirin. These are non-steroidal anti-inflammatory medications which are going to mess with your kidneys. I know that the occasional ibuprofen might not affect you, but what I'm trying to say is if we continue with the trend of self-medicating ourselves, even without knowing what we are suffering from, then we are at a risk of damaging the kidneys. So in as much as we are talking about high blood pressure, I want you to think also along the lines of the non-steroidal and anti-inflammatory medications. The other thing that will help you with high blood pressure this one will help you with both regulation and also prevention of high blood pressure. It is regular exercise. You see, when we exercise, we are increasing our heart rate. When we increase our heart rate, we send signals to our brain to release some very nice hormones or chemicals called endorphins. These chemicals sort of calm the body. They help the body to slow down. So even if the blood pressure was tending to go up after exercise, interestingly, the blood pressure comes down. So we need to incorporate exercise in our daily program. Now, I know that it is very easy for me to tell you to exercise, but I'll tell you something that I did. In January 2021, I realized I was very unhealthy. Unhealthy because I had become a couch potato, and it was becoming too comfortable to discuss about exercise and not do something about it. So I decided to start walking. Oh my goodness, you have no idea how terrifying that was for me, because I felt like my heart was coming out whenever I started walking. But the thing is, the more I walked, the better I became at it and the better I felt. Today, I can easily clock 30 kilometers, within the shortest time possible. So, I would say start walking. It is only last week actually that I started incorporating strength training. Things I do just here in my living room. So I'm saying that whoever you are, moms, dads, grannies, our loved ones, please start exercising. It is important. A simple walk makes all the difference. Nutrition and exercise experts are telling us that doing exercise is two ways. You can do it within a short period of time, but make it intensive, make it quality, or you can elongate it and do it small bits. I am more of the person who elongates things rather than doing them in short spurts. I would say consistency is the name of the game. So do not start walking this week and then next week you say, I'm too tired to do this. You need to tell yourself that you need to do this, okay? That is the other way to manage high blood pressure. The other thing that you need to do, ladies and gentlemen, and everybody else, my lovely Team Phoenix, what you need to do is take care of your stress management. Look, life is hard. I know life is hard for everybody, and it is hard for all of us in different degrees. There's something called when people say we are in this together, what they are trying to say is that we are not in the same boat, but we are in the same storm. Look, find a way to manage your stress, because what happens is that stress will release hormones or chemicals that we call catecholamines. Now, these things called catecholamines, it's such a difficult name, isn't it? They are fighting or flight, fighting or running away chemicals. That is what we call them. So your body senses that we need to fight. And if we need to fight, what we need to do is, number one, we need to increase the blood pressure. Okay, number two, we need to increase the heart rate. That is why when you're scared, you feel like you can fly over any type of fence anytime without feeling any type of pain because of the catecholamine release. But remember, when you're stressed, this is what is happening. Your body physically is not preparing for any battle, but your brain has told your body to get ready for action. So that means that your body is starts elevating the blood pressure, and this one is going to affect you, ladies and gentlemen. Look, we are talking about mental health today. Everyone is so mental health conscious, but I'm just wondering, what measures have you put in place to take care of yourself? To talk to people, you need to be able to find a way to debrief yourself, because you need to lower the blood pressure. I was reading this book that says sometimes you need to remove yourself from what is happening. Become an observer. Step out from yourself, from whatever situation it is in your life. Joblessness, hunger, homelessness, whatever it is. Just take a moment and step out of it. look at it from an outsider's perspective, to be very sincere, so that your blood pressure can calm down fast. Because there are two things. Yes, you have so many stresses going on in your life, but believe you me, you do not want to add high blood pressure to that, because high blood pressure will end up giving you something that is called what? Kidney failure, and that is what you are trying to avoid. So put that one under your belt. The other thing that we need to do, ladies and gentlemen, is if we are going to prevent high blood pressure, we need to increase our potassium intake. Potassium is found in things like broccoli, in things like bananas. They have lots of potassium. Let me explain. I told you about sodium, and I told you that sodium follows water, water follows sodium, salt, and everything else, isn't it? I will also mention to you that the relationship between sodium and potassium is opposite. So whenever we have sodium, potassium tends to run away. Whenever we have potassium, sodium tends to run away. Now, what happens with you who has not developed high blood pressure is, if you take an extra amount of potassium, if you take it in your diet, that is just an extra amount of potassium, it is going to help your body to get rid of sodium and water. And then your blood pressure is going to be normalized. It is as simple and as complicated as that. If somebody has high blood pressure, that's the other thing. They need to also up their potassium intake, as long as, and this has to be very well understood, as long as their kidney function is intact, the potassium intake will need to be supplemented. But if the kidneys have started failing, we need to be very, very, very careful with potassium intake. And this is where I'm saying you do not need to self-medicate. So you have high blood pressure, you do not know how your kidneys are, but you're here listening to Kate Mimi and you're telling yourself, I'm going to treat myself with potassium. Ladies and gentlemen, you're going to get a heart attack. You're going to get muscular contractions. You're going to get convulsions if you dare do that. What we are trying to say here is, for persons like myself whose kidneys are functioning well because we've checked them, we need to up our intake of potassium. But for people whose kidneys have started failing, whether it is stage 2, 3, 4, or 5, the different stages we talked about last time, you need to consult with your doctor, because one of the things they will tell you is actually to limit your potassium intake. Potassium is excreted, or it is removed through the kidneys. And if we mess with that, then if the kidneys fail, then we have messed with the whole balance of potassium. Potassium is important, really, because apart from helping me regulate our blood pressure, potassium gives us ability to contract our muscles, and it also helps the heart to conduct nicely the way it conducts, okay? The electrical conductivity of the heart. So that is what happens. I would say that we have discussed hypertension today, and we have discussed ways in which we can take care of hypertension to make sure that we do not end up with kidney disease. For anyone who has hypertension out there in the world, and hypertension means high blood pressure, please have your doctor check your kidneys. It is quite important for you to do that. And we have also said that high blood pressure, when we are trying to treat it, there are some medication that can also mess up with the kidneys, and it is important for your doctor to check the function so that they can decide which medications to use and which ones not to use. And while on the same topic, we talked about non-steroidal anti-inflammatory medications, and we cited Brufen, we cited aspirin, and we say these are medications that we need to not abuse, not go over the counter. There are so many other classes of painkillers out there in the world. We do not need to abuse those two medications. So that is it for now, ladies and gentlemen. It was short and sweet today. Next, I'm going to be talking about diabetes, because we have agreed that these two are the leading causes. We will discuss diabetes, and diabetes is quite a wide topic, just like hypertension, but I will do my best to make it compact enough for you to understand and to know what to do to prevent this monstrous disease that is kidney disease. So thank you very much for watching. If you have not subscribed, this is a very nice time for you to do exactly that. So until next time, toodles.